So, sickle cell disease can affect cognition mainly through blockage of the blood vessels in the brain. And so, um, some patients can get strokes, and these strokes are basically blockage of these blood vessels and lack of oxygen, and it can affect areas of the brain. And a stroke in sickle cell looks different than a stroke you'd see in the general population. Most people who get strokes are older, they have high blood pressure, high cholesterol, diabetes, and when they have a stroke, sometimes, they can't move, part of their body, their mouth, things like that. And that could happen in sickle cell disease, but what's more common, well, not more common, what is common is that patients can have silent strokes. So these are patients who they have a stroke, but they're walking, they're talking, they're moving, both their arms and legs, and you wouldn't necessarily know that they had a stroke. But if you scan their brain, you see that actually they had signs of a stroke, or they had evidence of a stroke on the brain. Uh, in children, we see this a lot where children may have like behavioral issues, they may have poor performance at school, and it's not clear exactly what happened. But then when you scan their brain, you see they actually had a stroke, and that's what caused them to have some cognition issues. Um, and so this could cause children to have behavioral issues at school, poor performance at school, and even in adults, there is a link that adults who've had multiple strokes, even multiple silent strokes, have difficulty attaining higher education, going to college, performing at work. And so really strokes are a way that can affect cognition in a way that's insidious and we don't even realize that it's happening.